process, we'll get a scan of the head and we'll also address this injury.
I'm in a difficult situation. I need to see some light, some positivity. The only thing that can help is hope. Hope can be in the form of a word. It's just a touch sometimes. Day in and day out, a lot of people, they come in with desperation, unfortunately. Our job is to make sure not just the treatment, but give hope. Without hope, humanity will not progress, will not see the positive side of their life story.
Star Hospitals is built by doctors, and as a result, the way they have structured it, the focus has always been the patient. Patients are people first. It's there even in the tagline.
Along with the outcome, it's important that we give that comfort to the patient and the patient family. We should be able to not just treat the illness, we should be able to heal the patient.
రాసి చూపిస్తారా ఒకసారి పేపర్ ఏమా నడచడం కూడా వస్తుంది నడవడం కూడా వస్తుంది. Here nobody looks at the watch. When a patient comes into the ICU sick at even at 4 or 4:30, everybody stays back. Until we stabilize the patient, we don't leave.
All of us talk, we discuss. I can pick up my phone anytime and call the cardiologist, call the pulmonologist, call the anesthetist and say, this is the problem, this is the patient I have. How best can we do a safe surgery for him? How best can we get him to recover faster?
In a hospital, there are two things which are important. One is the infrastructure, and the other thing is the experience and the expertise of professionals. Fortunately, we have developed centers of excellence in different departments, and we have professionals who are extremely good and who are trained both in the best of the centers in India and abroad.
Now we have got clinical expertise that's across the entire spectrum, entire disease process that exists. We have it in place.
The requirements of patients have gone up. People are looking for more comfort. Our own patient load has gone up so much. That's how this new hospital at Gachibowli has come up. This is a state-of-the-art facility comparable to any of the best hospitals in the world. Much more spacious, with an ambience where it's like a home. When you walk into the hospital, you don't feel like it's a hospital. You feel like you're at home.
We were very certain from the very beginning that we would not follow the route which usually corporate hospitals are known for, is to do a whole lot of tests, whether it is needed or whether it is not needed. There is no hidden cost for a patient. The belief in the hospital is very important. The belief in the surgeon is very important.
All the challenging cases, right? They come back and haunt you. So then you always keep thinking what else you could have done to make his stay smoother, what else you could have done to make him get better that little bit sooner.
Sometimes if you're not successful, it can take a toll. The idea is use that experience, grow from it, and try to save the next patient, because that's where you're going to create more impact.
One patient, she lost a child during her last trimester of her pregnancy because of a life-threatening illness called thromboembolism. And she was very sick, but we somehow managed to improve her. She recovered. She again conceived and had a child. And so I wanted to congratulate her and I called her. And she started crying. I said, why are you crying? So she said, no, I wanted a girl. I said, why do you want a girl? So she said, because I wanted to name her after you.
It is what you do in those few minutes that's going to define that patient's life and the people around him for God knows how many years. And that level of impact and in that short duration is what gives you, how can I put it, the kick.
When I look at my colleagues or my own experience, it is taxing physically. But every time you treat a patient and you heal him, that's a reward which is, you cannot compare with that. It's like winning 10 World Cups.
People stuck with us. That gives me the highest satisfaction. There's some security people who've been with us for 15 years, drivers. They all make a lot of difference to both doctors and patients, day in and day out. And their story was not sung. And people like me represent them. They were the pillars of our organization.
And I'm fortunate that I'm in this field where we are able to touch the lives of many people. We have very good colleagues in our hospital with the same kind of motto. That's what is making Star Hospital what it is today.